What is gender-affirming care going to look like under Trump's America? I'm Drew Morano. I'm a gender surgeon, and I've been getting this question a lot from my patients since the election. And with the inauguration around the corner, it's becoming more and more real. So what we do know is that the incoming administration has vowed to cut funding both for the federal-run Medicare program as well as state-run programs which receive federal funding. Those are the Medicaid programs. And so what does it look like after you've cut funding from these insurance carriers? Well, unfortunately, the result is exactly what the administration wants it to be. You're going to restrict access to care. Part of my job as a gender surgeon is not only to take care of individual patients, but also to understand how these systems affect the trans community. One of my research interests is public health, and last year I published a study looking at exactly this, barriers to care. Unsurprisingly, when we compared two groups of individuals, those who had access to care compared to those who didn't, one of the major contributing factors is whether you lived in a state that had trans health protective laws. Individuals who did not live in states with these protective laws experienced decreased access to care, higher rates of insurance denials, and higher rates of having no in-network provider to even provide this care. So yes, these laws affect the well-being of trans and non-binary folks. Now remember, this is something happening at the federal level. There is still significant power associated with the states. Medicaid programs, while they receive federal assistance, are state-run. And keep in mind that restricting gender-affirming care for adults is not a popular opinion. The majority of Americans do not support this. So continue to use your voice to protect the trans community, to protect access to this life-saving medical care, and limit the amount of damage that can be done by the federal government and the transphobe in chief.